In this lesson, risk minimization activities will be explained. One of the routine risk minimization activities is package insert. It is a basic activity for healthcare professionals, or HCPs. Patient medication guide is also a routine activity to manage the risk for patients. Several additional risk minimization tools and activities are adopted if necessary. For instance, educational materials for HCPs, restricted access, alert card for patients, etc. These are the examples of package insert and drug guide for patients developed as routine activities. In the package insert, warnings are written in red letters within a red frame, and contraindications are written in black letters in a red frame to draw special attention. Other information, such as compositions, indications, and dosage, precautions for use, are also included. The drug guide for patients explains the efficacy of the drug, checklist before use, the way to use, symptoms of adverse drug reactions, and so on, in simple terms that can be understood by high school students. The objective of the drug guide for patients is to enhance correct understanding of a drug for proper use and to help detect ADRs in an early stage. Next, let's take a look at some examples of additional risk minimization activities in Japan. First, education material. These pictures show guide for HCPs and leaflet for patients. These education materials include more detailed information than the package insert or patient medication guide. When the information gathered by routine activity is imperfect to minimize the risks, PMDA requests companies to prepare these education materials. The purpose of education materials is to ensure the safe and proper use of drugs. For instance, Guide for HCPs includes patient selections, administration methods, precautionary measures before and during treatment, ADRs and countermeasures, and so on. Second example is restricted access. There are some cases where restrictions of access to the drug are specified to control the risks and maintain proper risk-benefit balance as a part of additional risk minimization activities. For example, deliver drugs to only medical institutions with expert physicians who have a special training program and can ensure the proper use of the medicine. The target medicine has high risks, and if there are no set conditions, it is difficult to ensure a positive risk-benefit balance. However, such restrictions may impact the use of the drug. Therefore, careful consideration is needed. Third example is alert card. The alert card shown here is for the patients to quickly notice if the symptoms of the ADR are realized. The card is also used for the purpose of restricted access at the pharmacy. For example, patients bring the card and show it at the pharmacy so that the pharmacists are able to confirm the qualified patients. If a patient does not have the card, pharmacists contact the prescriber or report to the company. The card has blue RMP mark in the upper left corner for easy recognition. In practice, there are so many materials of drugs that HCPs don't understand which materials are for additional risk minimization. In response to the circumstances, RMP marks are inserted into materials for additional risk minimization. Furthermore, RMP and risk minimization materials, not only for routine activities, but also for additional activities, are posted on PMDA website. One more important factor is sharing related information among patients, HCPs, academia, regulators, and companies. RMP is a comprehensive tool for sharing risk management information among all the stakeholders, and proper implementation of RMP, including timely revision, ensures positive risk-benefit balance throughout the life cycle of a drug.